In this video, I'm going to talk a little bit about ACL injuries, ACL reconstruction surgery, and what you can expect if you choose to go down this route. So the ACL is the anterior cruciate ligament. It's one of the four main ligaments in the knee, which provides stability to it. There's been an increasing number of ACL injuries over the last few years, and it's now become quite commonplace, particularly in footballers and very commonly in people who ski. The ACL itself is essentially a thick band which attaches the thigh bone to the shin bone and provides stability both in the front to back motion, but also in twisting motions. As mentioned, the ACL is commonly injured through sporting activities and sporting injuries, and really the patients, when they have an ACL injury, will give a history of either twisting their knee or their knee collapsing, feeling a pop, immediate pain, the knee becoming quite swollen very quickly, an inability to stand on the knee, and then episodes of the knee giving way following this. Some ACL injuries can be managed without an operation and with knee bracing or knee supports and physiotherapy, and patients can get back to activities. But there are a large number of patients who can't. And in those patients where they have recurrent instability of the knee, they may wish to consider ACL reconstruction surgery. Now, the best ACL you have is the one that you're born with. What we do is to provide you with an alternate ligament, which is made from part of a tendon taken from your body. Occasionally, we can take tendons that are donated by others. This tendon is made into a rope-like structure to mimic the native ACL. And then in the surgery, which is done arthroscopically or keyhole, we make little tunnels in the bones on either side of the knee joint, and we fix the new ligament into it with little bits of metal. You then require a period of rehabilitation with a physiotherapist, and it can take a year to get back to sporting activities. In terms of the surgery itself, this is generally now done as a day case, which means you can come in the morning, and a lot of my patients go home on the same evening. It's usually done under a general anaesthetic, so you're fully asleep, and we provide nerve blocks which give you good pain relief afterwards. The first week or two after an ACL can be a little bit uncomfortable and sore, but then patients do recover pretty quickly following this. At the same time as doing the ACL surgery, I always check to see if there's any meniscal surgery that's required in case that's injured, and any other adjunctive surgeries that can help you in terms of your recovery and your return to the activities that you wish to do. A lot of my patients are worried about the recovery that's required after an ACL surgery, because it's commonly known that it can take a long time to get back to the sports. And there are reasons for this. So the immediate recovery actually isn't that bad, as the surgery is keyhole. It may be painful for a week or two. And at worst case, you may need to be on crutches and in a knee brace for 6 weeks if I need to do further surgeries within the knee, such as repairing the meniscus. However, during this time, you are mobile and you are walking around. The recovery in terms of rehabilitation can take up to a year. And that's because we need to give your body time to adapt to the reconstruction, for your muscles to get back into the right place, to get you back to sporting activities, and also give time for the ACL graft that's placed in your knee to mature and to become strong and fixed into the bone, and such that it can take the forces that are going to be put across your knee when you do return to sports.